technical issue. Hoping it's out of my hands. Let me introduce myself. My name is Abdalla Abotaleb, and I'm working as a project manager for WHO European region. It's nice to be with you today to sharing my technical reports, my analysis about what happened to health systems response during the COVID pandemic at low and middle income countries. It is a policy analysis and recommendation, and I'm focusing today at the infection policy and infection policy lines that happened at low and middle income countries. So let me start my presentation. Of the objective of this presentation, pandemicity of COVID-19 was not expected from any health system. It didn't matter if those systems were strong or weak. That pandemicity developed virus responses and led to questions asked from all healthcare professionals, like lessons learned from COVID-19 to health systems, analysis of health system response to COVID pandemicity, future of health system after COVID. And also, the objective of that research is trying to answer about the previous question, trying to find recommendation solutions for low and middle income countries through policy analysis for their healthcare system. Health systems at the following aspects: health system response, time of response, surveillance policies, and of course, infection control policies response. This is what I'm focusing today in my presentation. Method and research method, what we have done through this. First, we made an integration analysis for local data for low and middle income countries, plus literature review for international standards, plus international experience from countries controlled and managed COVID-19 pandemic. The following framework was developed according to WHO standards. The following framework was the standard for WHO for checking about the capacity and response for different health systems. So it is the standard globally. We faced some challenges for modifying some frameworks according to countries are just not using just only WHO standards. So we go through this, although we have some gaps during these standards, but we have to follow the policies for the countries. We're starting with the standards and bullets and blocks for healthcare capacity for pandemicity. We monitoring on detection and monitoring system, number of ventilators, healthcare professional workforce, healthcare professionals workforce experience level, number of hospital beds, turnover of hospital beds, number of public tests, technology solution, and finally effective policies for coordinate. And for the surveillance policies response, the fundamental and the blocks were detection and monitoring system, resources utilization and management, rapid adaptation of surveillance priorities at substitutional level, and rapid response tests for detection, collection and reporting of COVID-19 surveillance data, risk communication and community engagement, operation support and logistics, and finally technology solution. And for the infection control response, we monitoring and analysis for the following: capacity for treatment patient infection with COVID-19, capacity with investigation of all cases of healthcare associated infection, capacity of development of national plans to manage personal protection equipment supply, and finally capacity prevent transmission to staff, other patient, visitors, and in communities. And this is what we found. First, for the health system capacity, I want you to look to the following: effective policies for coordinate, number of public tests, and healthcare professional workforce. It doesn't matter. It doesn't matter how much you have turnover of your hospitals. It's pandemicity, and during pandemicity, you cannot tolerate and you cannot manage the turnover of hospital beds. Number of hospital beds also. You will have a great demand of hospital beds because it's a pandemicity. It's a pandemic situation. It doesn't matter how much you have doctors without their experience, without effective training, without effective communication and qualified person to manage. And I have some experience with some countries in low middle income countries, like for example, Algeria, Egypt, and Sudan. The mortality rate for medical staff, doctors, nurses, and other medical staff was high during to a lack of some experience for some of these doctors during the getting them into facing and management the COVID pandemic without efficient training. And also technology solution had a great help, but without coordinate policies effective, and without enhancement of public tests, it will not be a useful tool. And when we go into surveillance response, the main players and the main influencer item and bullet for effective surveillance policy is detecting monitoring system. And number two, the time and rapidness for response tests for detection. And according to the previous 2 points, we are going to resource utilization management. Without good utilization management for our resources here doesn't mean money. Resources means money, staff, equipment, tests all over, parts and equipment going through the cycle and process of management of COVID-19. If we don't have a very efficient, the efficient is good resource utilization and good resource management. If we didn't have a good resource utilization and management for our resources, we will have a severe reaction and severe problem of demand and supply. Detection, rapid response, resource utilization, and adaptive of surveillance priorities at subnational level, adaptation and dynamic policies are the main cornerstones for effective surveillance policies. If we don't have these policies, its arrangement and prioritization, we will have a failure of the surveillance policies response. Detection playing the major role. Detection with rapid response test is going to have an efficient surveillance. We cannot do this without resources utilization, and resource utilization based on adaptation of surveillance priorities of subnational level. And now, how this is a platform, a chart for WHO recommendation for the main approaches for contact tracing, starting from Ministry of Health, National Public Health Agency, and regional district offices. Finally, with contact tracing teams, this is the recommendation, this is the chart, this is the triage, and we should have in every country a dynamic prioritization policy for surveillance based on the needs of the countries. And this is during the COVID-19 pandemic, countries have used virus health communication strategies. They have virus health strategies, communication strategies. If we go to the previous slide, adaptation of surveillance priorities, making a good response for surveillance if we have a dynamic policy for response and adaptation. This is a comparison between low and middle income countries and MENA region for using ratio of technology solution at low middle income countries, starting from month February, ending with July. This is how the curve of low and middle income countries started and going, and this is how the curve of MENA region for using technology solution go and grows during this period. For this slide, we have in-depth analysis for technology solutions using and adaptation. If anyone wants to know in-depth analysis about this slide or the following slide, it's my pleasure to support him. And now we are going to infection control policies and response. This is the result for low and middle income countries. If you can see, there is no big difference between capacity for treatment and capacity for investigation and capacity of development and capacity for prevent. if you want to have an effective infection control policies, you should, or even sometimes you must, support all this function with the same strength, with the same priority. There is no big difference. So it's a bullets, it's a blocks. We must play and manage and modify the main four blocks for this policies if we want to have an effective infection control policy. And actually, this is what happening during any country during COVID, starting from coordinate, delay, supply, distribution failure, lab analysis, up and down according to needs, policies, effective management, supplies, uh, capacity until to finish out of lockdown. So it's a very dynamic situation, very difficult situation, changing with time. We don't know much about what we are facing. It's the first time to the world facing this pandemicity with this situation. We have different species for coronavirus, so it's very difficult situation. It's need dynamicity for all our policies to manage this pandemicity. And this is comparison between capacity of treatment of low and middle income countries and MENA region. This is starting from February. According to lack of infection control policies and dynamic surveillance policies, plus awareness and plus effective coordinate policies, the capacity was declined in the May months, what was the peak for different countries. If we go to the capacity of treatment of COVID-19 during this area, it was plateau. They have a good health system response for pandemicity in the area of treatment of capacity, but low and middle income country had some problems. And this is as a result for the previous slide. This is providing service effectively between low middle income country, MENA, and Germany. Why I choose Germany? For many things. First of all, Germany has a good planning and good detection and good surveillance strategies versus COVID. Two, they didn't spend a lot of resources for this. I mean, they spent it in effective way, in efficient way, not like other countries. So if we going to planning, this is the difference between low middle income countries and MENA and Germany. And in the issue of managing low middle income countries, slightly little bit better, and maintaining, this is a problem for some of the countries of low middle income countries. The maintaining process, it's very difficult, and it is needs sustainability for the system. This is why we are going to recommendation about the maintenance. This is ratio for tests for low middle income countries and compared to region, MENA region, starting from February, slightly near to each other, despite the economical differences and variation between these countries and the MENA region. But I think it's near to each other, and test is public testing without putting it in a good efficient management policies for the COVID, including surveillance and infection control, will no use. This is lead to conclusion and recommendation. Developing effective infection control policies will help to achieve successful coordinate for reducing economic burden and capacity burden on healthcare system. Developing dynamic, effective surveillance policies will reduce resources and pressure on health system. This system achieved through adaptation of surveillance priorities through efficient resources management plans, and one of the major elements for that plan is well-trained and experienced medical staff. This was my presentation today.